What happens is the repetitive movements over time weaken the soft tissues. For example, like a backhand in tennis, when a tennis ball makes contact with a racket, that force of impact is absorbed into your forearm muscle. A lot of that force is transmitted from the muscle down the tendon into where it attaches into the bone. In a repetitive strain injury, very small tears develop in either the fascia, which is the covering of the muscle itself, or the tendon that generate inflammation. And pretty soon you get some swelling there, some pain, and in some cases the tendon lifts off a thin layer of the bone. Sometimes it heals within a couple of days, but for other people, especially if you continue to do the offending activity, it may develop into a chronic condition. You may develop scar tissue. Scar tissue is what your body creates to repair damaged soft tissues. Scar tissue is secreted by special cells called fibroblasts that lay down reparative tissue, very similar to collagen, but it's disorganized. A good analogy would be like a patch on an inflatable raft to close a cut. If there's any stress to that raft, the most likely place for a failure to occur will be that patch because it's not consistent with the material. It's a repair patch. And you can view scar tissue in the same way. If it's severe enough, then you may want to see your doctor, and the doctor may prescribe a cortisone injection, which is a powerful anti-inflammatory. The effects could be instantaneous, but you definitely don't want to get too many of those because repeated cortisone injections can actually weaken your tendons, make them brittle. If your repetitive strain injury is chronic, you can try using a flat-edged instrument such as this myobar. What you're doing is rehabilitating the soft tissues that are experiencing the chronic pain. You're doing two things. Number one, softening or breaking apart the scar tissue adhesions. Now, the adhesions are believed to be part of the reason why the injury doesn't fully heal. These adhesions stick together and they make movement of that joint and the muscles and tendons encumbered, which prolongs the injury. And number two, with the myobar, you're agitating the area. That is, you're increasing vascularization. And you'll have the reparative agents come out, the fibroblasts and the white blood cells, and you'll speed up the elimination of waste products in the area. These are the types of things that help chronic soft tissues regenerate faster. So I'm going to show you a simple self-help approach to treating chronic repetitive strain injuries. What you'll need is an instrument like this myobar or this therapy massage star, and an emollient, and it could be something like this, sports ice. There's other names for it like biofreeze or sombra. These make good massage emollients for this purpose. And let's say I have right elbow epicondylitis. It's crunchy in there, it's been painful for a while, and I'm going to put it right here. That's typically where the area is for epicondylitis. You take your edged instrument here and just simply go like this. Just put a little bit of pressure, not too hard, just like this. And you'll actually feel vibrations in this instrument when it hits like a patch of scar tissue. It'll feel kind of gristly or grindy in there. And then when you hit a spot, just go like this. Keep it there, then just go like that. What you're doing is just rubbing it out. Stretch it out like this. It's almost like ironing those scar tissue adhesions away. Just go around, and you shouldn't do this for very long. You don't want to overdo it, definitely. But do it till you feel like that gristle has softened up somewhat. And it only requires you to do this just a couple of times, maybe 3 or 4 times, and just observe how your arm feels in a couple of days. Massage star is very similar. It has different edges like this. It's got different contours. You can even use a contour to go in like this. It's got a broad-based edge that you could use to press into the muscle, and a pointed edge like this. And these are used for trigger point work.